Hey everyone, I'm John Lynn, the founder and chief editor at Healthcare IT Today, and we're excited to bring you another in our series of interviews with top leaders in health IT. And our guest today is Jay Nakashima. He's president at eHealth Exchange. Welcome.
Thank you. Thanks for having me.
Yeah, great to be here. Lots to talk about, lots happening with interoperability, and in particular, eHealth Exchange. You guys have more projects on interoperability than I was surprised when you announced it. But anyway, for those that don't know you, tell us a little bit about yourself and eHealth Exchange.
Yeah, so Jay Nakashima, been in the healthcare interoperability space for, a good 30 years. And live in Denver, Colorado. Our company's headquartered out of DC, and we facilitate the exchange of electronic medical records.
Awesome. So as you look back at 2025, how would you describe the shifts that you're seeing in healthcare and interoperability in particular under the new administration, and maybe what implications do those changes have for nationwide data exchange?
Yeah, great question. So, the new administration took a while to get settled, if you remember last fall. And then, of course, we've had a government shutdown recently. But the new administrations do seem to be really settling down on various strategies. So, the most surprising and interesting is the CMS-Aligned Networks. And so it's part of CMS's broader modernization effort. And so it'll be interesting to see how the CMS-Aligned Networks concept fits in with TEFCA.
Yeah, I think everyone's asking that question and
right.
Interested to see where there's overlap and where there's learnings and how that continues to grow. As I mentioned, eHealth Exchange has been doing a lot. What would you say are some of the accomplishments that stand out most for you over the last year?
I think the big one is going to be bulk FHIR. So for interop nerds, that involves the exchange of data not just for one patient, but for an entire panel or population of patients. And of course, it's using the more modern APIs. But we've rolled that out so that payers can retrieve data from providers' EHRs to identify care gaps. Like, hey, maybe you've got someone who's over 50 or whatever and hasn't had a colonoscopy, or maybe it's a missing mammogram, and they're able to surface that and help out with the HEDIS reporting.
Interesting.
Yeah.
I think the thing that stood out for me was, I think you said 25 billion transactions annually, exchanges that are happening. That's amazing. And then also the breadth of organizations that are involved. I think that's so impressive what eHealth Exchange has accomplished.
Yeah, absolutely. And we have a number of anchors who've really led our success, and the 5 federal agencies in particular play a part. You've got the Veterans Administration, the DoD, so the Defense Health Agency, the Social Security Administration, Indian Health Service, and FDA. And FDA has really led the nation in the use of modern APIs. So they do that so that they can exchange adverse events. And they've been super impressive.
That's awesome. So as we kind of look forward and move into 2026, what would you say are some of your top strategic priorities for expanding the interoperability that you're doing, and especially around FHIR-based exchanges or even the payer connectivity? I know you were on a panel today talking about that, or support for other emerging use cases.
Yeah, so the vast majority of our exchange is intended for the HIPAA treatment purpose. So think about a clinician at a chairside, bedside, tableside, about to prescribe or administer a medication, whatever. And that's fantastic. That was the right place to start, 15, 20 years ago. But now that eHealth Exchange and other national networks have largely matured that, it's really time to expand for exchanging data beyond treatment. So for public health purposes and payer-provider exchange and so on and so forth. So in 2026, we're going to continue with our current strategy. And that is to, again, branch out and try to increase adoption for public health exchange and payer-provider exchange. We're also hopeful that we might get another federal agency or two, but that's hard to predict.
Yeah, of course. That's interesting. As we kind of discussed, there's been a lot of discussion about how TEFCA and the CMS-Aligned Networks will coexist, and in some ways they're a subset of the other. I heard Amy talk about that today, which was interesting. But as an early adopter who pledged to become a CMS-Aligned Network, you're also a QHIN. You've been part of TEFCA since the beginning as well. How should organizations think about participating in both as a nationwide interoperability continues to evolve?
Yeah. So, my crystal ball is just a little foggy. I think we'll be a lot smarter in 6-8 weeks or something like that. But I would say organizations should stay the course. I think they should, if they joined TEFCA or had planned to join TEFCA, they should proceed with that. And then maybe keep an eye on the CMS-Aligned Networks. eHealth Exchange thinks that, or believes that we can do both. We can be a CMS-Aligned Network and a TEFCA QHIN, Qualified Health Information Network. So I really see the two concepts as complementary. Certainly not, you've got to choose one or choose the other.
I think as I understand it, CMS wants the opportunity to innovate. And TEFCA and QHINs are governed by the governmental response that has to have rulemaking and things like that. And so this is their opportunity to do pilots, to do, and the industry to do those types of things that then they can then either merge into TEFCA and QHINs and be inspired by it, or if they don't work. And to me, that's where it feels like it is. And so if you're a provider organization, if you're a payer, you probably should do both, because you kind of described, and I don't think it's mutually exclusive, and I don't think they overlap either. I don't know. That's how I view it.
I think you're absolutely right. And TEFCA has been incredibly prescriptive over the past 3-4 years. Sure. Before it was live even, very detailed, and there's largely one way to do things. And so I think some of the other national networks and I are having to kind of readjust our worldview, now that we have the CMS-Aligned Networks, where there's the expectation that industry comes forward and sees what's going to work. Yeah. It'll be fascinating.
Yeah. Well, there's a lot of interesting pressures happening right now that you have to balance, right? You have the regulatory requirements that every healthcare organization is facing. You have infrastructure modernization that a lot of organizations experience. We have rising expectations from consumers that they expect a kind of Uber-like experience, right? Convenience, et cetera. Like, what message would you share with organizations that are preparing for that next phase of nationwide interoperability?
Yeah, I would say change is gradual or incremental. So it's not going to happen all at once, and it will never be an Uber-like experience, just because the healthcare data is so complex. We've all heard the comparisons with banking. Well, I'm sorry, banking is very simple. You've got a checking account, money goes in, money goes out. With healthcare data, you've got multiple providers, you've got lab data, medications, lots of notes, allergies, et cetera. So it's always going to be complex, but we can do much better in simplifying the way data arrives and then how it's used.
That's interesting. Someone said on stage, I think at the Health Exchange annual meeting, they were like, the opportunity is there We just haven't scaled it. Do you feel that's how it is? You know, that like, hey, we now know how to exchange data. We know how to validate the endpoints. We can share it. We just need the people to have the will to be able to scale it. Do you agree with that, or what's your perspective on it?
Yeah, it's interesting because we have scaled it when it's exchanged from one provider to another provider. You know, again, that's the 25 billion transactions.
Sure.
But we haven't scaled it in terms of delivering that data to individuals. You know, so if you get on your mobile phone and you have an individual access app and you want to retrieve all of your medical records, there's still some extra steps you've got to do. And that's one thing that I'm really excited about with the CMS-Aligned Networks. Those organizations who pledged to become one, like eHealth Exchange, will not be permitted to require consumers go out to a web portal or whatever and double validate their identity.
Interesting.
Yeah.
Well, there's a lot happening, a lot of interesting conversations, and I also think there's a lot of work by really smart people to solve a lot of these problems.
Yeah, absolutely. You know, when I got involved, when I started working with National eHealth Exchange 8 years ago, you know, the vendor-owned networks were pretty immature. And I've been really impressed with how quickly they, as well as eHealth Exchange, have matured over the past 8 years.
Yeah, absolutely.
Yeah, really sharp people with good intentions.
Yeah. Jay, I appreciate you taking time to talk with us. I know it's a busy conference time for you as well, so thanks so much for talking with us. And thanks everyone for watching and listening. If you want to find more great healthcare IT content like this, be sure to check it out at healthcareittoday.com or search for Healthcare IT Today on your favorite podcasting applications. Thanks, Jay.
Well, thanks for having me.